My name is Diana Weber. I'm a nurse practitioner provider, and I'm from Oklahoma, which is a state in the middle of the United States. And I became involved with this medical team. First time was 2004, and my friend over there, who's sitting by himself, who's the youngest of us all, I got to know him that week, and one thing fun we did together was we slid down waterfalls, and that was such a fun experience. And since then, I've just grown to love this team. I've known Tabitha since 2004, and she's always been just like my sister, and she is my sister in Christ, just like Carlos is my brother in Christ. But this team is the most awesome, unique group of healthcare providers with which a group can be associated.
So Tabitha Danley, I'm family medicine obstetrics, and like Diana said, I started in 2003 when my husband and I came for the first time. We were what we call baby doctors. We were still in training, still residents, and then when we came back in 2004, we met Carlos when he was training in medical school, and here we are in 2026, and we've known each other since 2004, and now
22 years.
Yeah, and now we're bringing our kids on the trip, and our kids are getting to know each other. My boys have been on the trip in the past, and so they got to meet Aaron, who's his son, and the friendships that they've made are just very special. And I appreciate Carlos for his wisdom and for knowing when we don't know, hey, you know, is dengue happening now? Or what are they giving metronidazole for? Oh, it's for giardia. And so just him knowing his people and each region that we go to, I know that I learn so much from him being a Peruvian doctor. So I love and appreciate him as a Peruvian brother in Christ.
Oh, thank you for that words. Actually, I am very proud of being a friend of these two ladies, because actually I learned from her and from Tabitha, for Diana. I always admire to Diana, even she is a nurse, but she's a nurse practitioner, and I learned some techniques, special techniques, treating chronic diseases, for example, with patients. And well, also with Tabitha, well, she was I was a student when I started in 2004, but in 2005 I became a doctor, and she always was teaching to all this group that every year comes year by year, and I was always a pupil from her and of her. And well, I'm very proud of this group, especially from Oklahoma City, and we had other folks from other states, but Oklahomians are nearly my brothers. Yes. Actually, I don't know if I catch their accent, but sometimes I have some accent from the southern. And I am very proud of all these guys, especially from Diana, from Tabitha, who every year came. I don't know if we missed 1 year probably, but all the 22 years that we have friendship, we always work together. And as Tabitha mentioned, we are trying to transfer that feeling, that how can I say, proposal to our kids. And now I have my son. My older son is 14, but he's coming since he was 10 probably. And I knew Hannah when she was a little kid, and the other kids also, Ethan and Alec. Yes, they visited us, and they enjoyed the gift that God gave to us, and we want to share the love and the mercy of our God that He shows to us every day. So I am very happy to participate in this kind of trips, because God blessed me when I come here, because He used me to bring the gifts that He gave me as a grace, because everything is for Him, not for us.
Absolutely.
And yeah, I'm very happy and very proud of here my partners and friends.
Absolutely.
Can I make one more comment? Okay, one thing that I see here is we're from 3 different generations, okay? And I'm in the older generation, and I'm always looking for someone who's on my bench. Who am I sharing my purpose with and training them up? So these trips are an amazing time for me to mentor a younger healthcare provider and try to infuse that enthusiasm and purpose in them. Well, she's in a different place. How does that affect you, your purpose for this? Do you see the replacement process going on for you too? The same?
Absolutely. So it's been, going from myself being a trainee and then now working with medical students and residents who are coming. If we can instill the love of others with just one of the students we're working with. If you think, some years we have 40 students, and some years we have 60 students, and some years we have 30 students, and if just one of those people takes that desire to help others outside of their comfort zone in other countries, then I feel like we've done our job as trainers of medicine, but then to understand how the love of God in our sisters and brothers in other countries, if just one person captures that fire of all the years, 22 years of 40 to 60 people per year, I mean, how many of the students have been influenced by our generation, 1, 2, 3, then we will have passed that torch and pass that responsibility on, and it makes me very excited for the future.
Yes, we hope so.
Yes.
And we wish that.
Okay, yeah. It's pretty important for me when I was a young student, and then after becoming a doctor, I used to train also to the students that come, and I used to teach them, the common diseases and the common drugs that we used to use here, and then maybe they are not familiarized, but it's a good experience to teaching them, and not only teaching them medicine knowledge, but the spirit that we have every time that we have a patient, sharing the love of God and praying for them, which is very important. Maybe medicine have a limit, but the power of God goes beyond that.